This is our first segment of Ask Dr. Braun a Question. And one of the main questions that's on everybody's mind is acne, because acne affects almost everybody in their life at some point. And we see acne every day. So ask yourself, do you have to live with this? And the answer is no. There's many treatments for acne that we have now. And what I'd like to do is show you basically how acne forms with a few simple diagrams. It's actually not rocket science. If you look at this first picture here, you see a hair follicle with an oil gland. Every hair follicle on your face has an oil gland attached to it. That's how the hair gets lubricated and it keeps the skin from drying out. Now, for a variety of reasons, almost all hormonal, you can block the opening of the hair follicle there. Okay, and when that happens, this will form a whitehead or a blackhead. As you can see in this picture, here is a blackhead. This is the beginning of the acne lesion. Or it could be a whitehead, which will result in the same problem. As you can see in the next picture here, the oil can no longer get out. The gland is still making oil and it piles up underneath. When you have all this oil in a wet, dark space, bacteria love to live in there and eat it. And the bacteria are called Propionibacterium acne, or P. acne. That's where the name acne comes from. It's the name of the bug that has infected the oil gland. Now, what are the treatments for this? Well, one is stop the oil gland from being blocked to begin with. That would be great. If you don't have a blackhead or a whitehead, you can't get a pimple. It's that simple. So how do we prevent this? Well, there's many different means. One of them is chemical exfoliation, okay, and that would be with like alpha hydroxy acids, beta hydroxy acids, sal acid washes. You'll see in many washes there's 2% sal acid. That causes a chemical exfoliation to remove these blackheads and whiteheads from forming. The other thing is mechanical exfoliation. That's like using exfoliating polish. We use those in our clinic where we rub these rough polishes on your face, and you can do it in the shower as well. That mechanically exfoliates the skin. So you do chemical exfoliation or mechanical exfoliation. The other thing that works very well to stop these whiteheads and blackheads is vitamin A, otherwise known as retinol. If you use a retinol on a regular basis, you will have less whiteheads and blackheads and consequently less acne. The bottom line is you don't have to live with your acne. We can make it look a lot better. And in fact, if we use all our multiple modalities, nobody has to have acne anymore. So stay tuned for my next Ask Dr. Braun a Question.